I'd like to welcome everybody back to our second installment of our OEO Member Spotlight. And today I'm happy to welcome Dr. Anna Juricic to the OEO Member Spotlight. Good morning, Anna.
Good morning, Jeff.
Thanks for joining us. Could you tell us a little bit about when you graduated? And I understand you've practiced in a few different cities so far, so maybe if you can bring us up to speed on where you're at now.
Okay, great. Jeff, I graduated in 1996 from the University of Waterloo, and when I graduated, I went back to my hometown of Windsor, and I practiced in Windsor for 4 years, first as an associate, and then I opened up my own full scope practice in 2000. In 2009, I sold that practice because of my husband's work. It brought us to Toronto. And when we came to Toronto, I remember my husband asking me, do you want to have another full scope practice? What do you want to do? And I wanted to actually just continue focusing in the area of low vision. When I opened up my clinic in 2000, it was a full scope practice, but I incorporated a low vision center, which was kind of unique of its kind in southwestern Ontario at the time. So coming to Toronto, it was important for me to still continue the low vision work, and I was able to help create kind of my own position with an ophthalmology practice at the Clearview Institute. So I get to work with a team of ophthalmologists and still continue my work as a low vision optometrist now. I only do low vision.
So for other colleagues out there, other optometrists looking to add maybe a low vision subspecialty to their practice, what barriers do you see that exist now for optometrists to incorporate that into their practice?
Well, one of the big things with low vision is that it takes more time. So myself, I spend about an hour and a half with each patient. And unfortunately, at this point in time, there are some government barriers. We don't have a designated low vision OHIP code in Ontario. Um, uh, Ophthalmologists do have a separate code that they can code and bill for low vision, but here in Ontario we do not. So in terms of having a patient pay for the exam, some optometrists find it's a little bit difficult to have some patients pay for an exam if the patient doesn't even know if they're going to get the help that they need. So many patients at one point in time may have been told nothing can help you, and so a patient to have to pay for a low vision exam not knowing if there will be any benefit, that's a bit of a barrier. We also do run into other government restraints in terms of we do have an assistive devices program here in Ontario, but the program has its flaws. It takes a while for us to get paid or to even get the authorizations. So those are some of the barriers, but there are definitely a lot of rewards when we talk about low vision as well. And the big thing is that you help people. It's an area that's very much underserviced, and you know, seeing a patient get the help and being able to see again, where they can read the newspaper, read books that they may want to be able to read, see faces. There's definitely that rewarding aspect to the area of low vision, and that's why many of us who do low vision practice it.
So is it fair to say that most of your colleagues that delve into low vision as deeply as you do practice with an ophthalmology because of the billing code aspect?
With the billing code, that's something very recent. So I find that a lot of my colleagues in Ontario who might be doing low vision, they've been practicing low vision before that code even became in existence. So some may have it in their own practices. There are other colleagues of mine throughout Ontario that also work with ophthalmologists as well, just to help with that barrier issue that we've run into. Low vision is such an underserviced area in all of Canada, not just Ontario, and so there is definitely a need, but unfortunately there's not as many of us who practice it. The ones who do often are quite passionate about it, and we're more than happy to help the patients any which way we can.
It seems like such a natural space for optometry. Optometry should be the gatekeeper, in my view, in low vision. So if we were to get a billing code for low vision, which was similar to ophthalmology, do you think that would really kind of kickstart optometry's role in this space?
Well, definitely. I could see where there'll be more optometrists who might be more interested in doing the low vision. Again, it does take more time, so that's something that optometry definitely has the capabilities. And I often say when I'm lecturing to up and coming UW grads when they come to our clinic, I definitely encourage them that you already have, all optometrists already have the tools to be able to do entry-level low vision assessments. When somebody has 20/40 to 20/80 vision, the first step is refraction. Introduce a higher add, talk about good lighting. So that's something that can be done in just a routine eye exam without it even being classified as a low vision exam. And of course, there are going to be some patients who need more devices. And for those colleagues of mine who don't do low vision currently, I definitely encourage that they find out who may in their area do low vision and refer them. The way I like to address every low vision patient, or I'll even pose this question to my colleagues, is if something were to happen to your own vision or to the vision of a loved one, a parent, an aunt, an uncle, a grandparent, wouldn't you want to do everything you could for that person or yourself to see the best you can? And that's an area that low vision provides. So that's one way I think everyone should really look at every patient they see who may have vision loss. What options are there? How can we help that person? If you don't do it yourself, who in the area may do the low vision? And my colleagues and myself are more than happy to accept the referrals, do what we can, and send that patient back. We don't want to do the routine maintenance of care afterwards. We want to be doing the low vision assessments for the patients who need to see us.
I think that's probably one of the biggest shifts that I've seen since I've been practicing for 20 years now is I'm referring on a monthly basis to colleagues in my area based on what their subspecialty is. So I think that's a wonderful thing we're starting to see take shape in our profession. So switching gears a little bit, I understand that you're also involved in some charity aspects of folks that are blind or partially sighted. Do you want to elaborate on that and tell us?
Yeah.
I understand you have an event coming up.
Yes, I do. So I like how you said the switching gears. That's a great pun intended there. Since 2012, I've been involved with Cycle for Sight. For those of you who don't know, Cycle for Sight is a annual fundraising event in support of the Foundation Fighting Blindness here in Canada. And the Foundation Fighting Blindness, their whole mission is to support research for retinal eye diseases. And two of my patients were among the original 4 co-founders of Cycle for Sight in 2009. And the one thing that I'll tell you with meeting and seeing the low vision patients, I get inspired every single day. It's amazing what people with vision impairments of all degrees and levels are able to achieve. And these 2 patients of mine created the Cycle for Sight event where all of us who are eager to do so, we cycle from Toronto all the way up to Collingwood Blue Mountain area. So it's 104, now it's a 145 kilometer trek for some people who are not into that whole 145. There's also Alliston to Blue Mountain, which is 75, and there's some other distances in between. And I've been doing this since 2012. It was something that I knew I wanted to give back. I wanted to give back to my patients. But I'm also a mother of 4 young kids, so this is my way of being a role model as well. And one thing a lot of people always ask is, well, were you a cyclist beforehand? And I will honestly tell people that if I would have cycled 140 kilometers in 10 years, that was actually an exaggeration. So to do it in one day, it's pretty impressive. And I say if I can do it, anybody can. I start training in January, do my spin classes, and then do some outdoor training. But the one part that when I decided to do Cycle for Sight, I wanted to make sure that if I was going to do this, I was going to do it all the way. So I actually do it on a tandem bike. And my cycling partner is completely blind. So it was really important for me to do the event where I was doing it on a tandem bike and do the event with someone who was vision impaired or blind as a great way to give back. And I find that it's such an inspirational day. Leading up to the event, it's absolutely inspirational. The people involved are great. I've had some colleagues who've joined me on the ride at the Clearview Institute where I work. We've had the I See Hope team that we've created, and I think we've raised over $65,000 in the last 3 years for the Foundation Fighting Blindness through our team alone. So if there's any cyclists out there, and I know I've talked to Jeff that he cycles, and he's just getting ready to really commit and hopefully join us on June 20th. It's on a Saturday, June 20th in 2015. And if there are any other cyclists, absolutely, I'd love for you to join us, join me on my team, or even if you want, I'm going to challenge anybody to create their own team, and let's see what we can do as a great fundraising event. It's all for a great cause.
That's a great story, Anna. And I'm being an avid cyclist. I've been cycling for 20, 25 years now, and 140 kilometers is certainly a huge feat. So good on you for doing that. Maybe at the end of the video, I will put up the name of your team and maybe a web address where people can link to that and potentially join
Yeah.
your fundraising efforts.
And that'd be great. And for those who are not in the Toronto area, there's also an event that takes place in Ottawa. And you can just go on to www.cycleforsight.ca and you can check out the dates there. And if you have any colleagues out in the West, we have an event in Vancouver and also in Calgary. So I know a lot about this because I've been co-chairing the event now for the last 2 years. So the one person, the patient of mine who I can say Mike made me do it. He has his own team called Mike Made Me Do It. He makes you do some interesting things, and like I said, he's absolutely inspirational, and it's a great, great, great event. It's amazing to see that it's expanded to 4 cities now.
Well, thanks, Anna. Thanks for sharing your passion for your optometry subspecialty, low vision, and your charitable efforts. So again, thanks for joining me this morning.
Thank you so much, Jeff, for having me.